Hi there. Thank you for joining me once again on the program, Your Doctor and COVID. I'm Dr. Mahendra Carpen. I'm the head of medical services and cardiology at the Georgetown Public Hospital Corporation. As usual, we're talking about COVID-19 pandemic. This is the purpose of the show, and this pandemic continues to have a significant impact, not just on our lives in Guyana, but across the world. I'm wearing my mask in the correct way to cover both my nose and mouth. I'll take it off for the rest of this conversation. Remember, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. Now, the emails as well as the messaging, they're controlled by persons in the studio. These are not messages that come to me personally. So please don't be offended if you don't get an immediate response right away. What we usually do is that we look at the questions and the comments that are coming in, we put them together and then see if there are common questions, common concerns, and these are things I would then answer on the show. It is not designed for me to give you a call back or answer personal messages right away. So here we are now in the beginning of June 2021, and COVID-19 pandemic continues to rage its effects across this land. We have had over 400 persons dying in Guyana, over 500, almost 600 dying in Trinidad and Tobago, and a similar number in Suriname. These are very close to our homes, and across the southern borders in Brazil, for example, the numbers are much more significant. We continue to be vigilant. We continue to have all safety measures that are reasonable in place, and unfortunately people still sometimes have difficulty in following the guidelines, still have difficulties in maintaining the simple practices, and so we end up with high numbers of persons being infected. Luckily, we have seen some kind of stability in the numbers as it relates to hospitalization, death rates, and positive numbers, and we want this trend to continue in a declining manner so that eventually we will exit this pandemic. Now, there are two ways in which we can exit this pandemic. Two ways. The first way, which seems to be the more painful way, is to actually get COVID as a disease and then recover from it. And that recovery would mean that you have developed some kind of natural immunity to the disease. So that is one way. The second way of exiting the pandemic is to get the COVID-19 vaccine. And this, we think, is the better way because of a couple of things. When you get the COVID-19 disease, there's no guarantee that you will recover. Still, across the world, regardless of where you are, which country you are in, how developed the country is, how rich the country is, the chances of dying from COVID-19, if you get it, is still between 2 to 3% across the board. And so far, we have not had anybody in Guyana and around the Caribbean who have died from COVID-19 after receiving full dose of the vaccine. And that's a very important thing to understand, that all the vaccines across the world, all of them have been shown to be 100% effective in preventing severe COVID, in preventing hospitalization in an ICU, in preventing people from getting on a ventilator and dying, all of the vaccines. So the deaths that we are seeing across the world and in Guyana have all been from persons who are not vaccinated. Our own experience right here at home has shown us that since we started our vaccination program, not a single person who died was someone who had full vaccination. In fact, even a single dose of the vaccine has been shown to protect people. No one who would have had their vaccine for more than 2 weeks. That's even a first dose. No one so far that we know of would have died. And that is a very significant and important observation. So we have seen that the vaccine is protective. We have seen that it is the better way to exit the pandemic. If you want to get back out into the public, if you want to walk around without masks, sit at restaurants, go to nightclubs, mingle with people in church, in the workplace, etc., without the mask, without all of the COVID-19 guideline and specified behavior patterns, then the best way to get to that state is to have enough of the population vaccinated. In countries across the world, we're seeing significant declines and drops in infection rates, hospitalization, and deaths in countries that have had successful vaccination programs. As far away as Israel, in the UK, in the United States, we have seen significant decrease in the number of positive cases, decrease in the number of ICU hospitalization and deaths from COVID-19. And that's encouraging. It's important to note, and hopefully we get to that state in Guyana where significant number of our persons are vaccinated, and so people are then dying less, not getting admitted to hospital and ICU, etc. Every death is regrettable. Every death is important. And we need to work continuously to reduce this number from where it's at now to 0 deaths per day. It is doable. Many countries have achieved it, and they have done so mainly by a combination of public health measures and an aggressive vaccination drive. Why is it dangerous to actually hope to get the disease and recover to develop immunity? That's a very important question, because one, there is no guarantee that you would recover from the disease if you were to get it. Yes, the majority of people will recover, but what really constitutes recovery? It is not just the first couple days after you survive the disease that you're better and things are back to normal forever. Too many people, having gotten infected with COVID-19, they recover from the acute state of the illness, but then continue to have symptoms, significant symptoms, not just mild or annoying symptoms, but things like chest pain. And when people come to me as a cardiologist with chest pain, you're obligated to look deeper to find more significant and serious causes for chest pain. In my field of medicine, the biggest worry for chest pain is heart attacks and blockages in the heart. So when people, even though they might be young and they come to me having recovered from the acute phase of COVID-19 and they have chest pain, I still have to test to make sure that they don't have any significant underlying cardiac conditions like blockages, etc., that can lead to heart attacks, that can lead to death, that can lead to heart failure and heart rhythm problems. So people then need to have ECGs done. They need to have echocardiograms, which are ultrasound of the heart. People need to have stress tests done. And occasionally, rarely, they may need to have angiograms done. And these are all important things to rule out and to make sure that people don't have significant underlying heart problems. They're not free usually. They cost something to the patient, not just time, but also financial resources. So this is not the best way of trying to develop immunity. So that's just the cardiac conditions. Chest pain could also be as a result of clots in the lungs. It can be also as a result of inflammation of the muscles, of the lining of the lungs and the heart. And these are all things that we see as happening after recovery from acute COVID-19. A number of patients also, having recovered from the acute phase of COVID-19, they develop other symptoms, other real troubling issues. They have problems with sleeping. They have problems concentrating, anger management, control of emotions. People become depressed, almost like if a soldier who has been to war and has seen terrible things, then they come back with something called post-traumatic stress disorder, or PTSD. We have seen this a lot and significantly in those who would have been hospitalized and in an ICU setting, where on a daily basis they would observe persons right next to them dying from a disease that they themselves are positive for. So you imagine you lying down in bed with a diagnosis of COVID-19, you're having some shortness of breath, and the person right next to you with the same diagnosis of COVID-19 is having shortness of breath, and you're having to watch them be put on a ventilator and not being able to communicate, not being able to talk to their friends, their families, etc. And then watching that person over the course of hours or days, unfortunately dying. Now you start to wonder, when is my turn? Am I going to get better? Am I going to get worse? And these are things that play on people's minds and worry them. So even after they recover, they still have flashbacks. They still have disturbances in thought processes. People can develop psychosis, depression, anxiety. All of these conditions can occur in persons who have had COVID-19, and even after they recover from the acute phase of the illness, all of these things can still be present in these patients. So it is not the best way to hope to get the disease and then recover, and that's how you get immunity. The best way, the safest way, the most highly recommended way of getting immunity to COVID-19 is by taking the vaccines that are available. In Guyana, we have 3 main types of the vaccines that are available. We have the main one that first came in, the AstraZeneca, developed by Oxford University. We have the Sinopharm from China, and we have the Sputnik from Russia. The data and the science has been evolving. We know at the beginning we started giving these vaccines typically at 3 weeks interval between first dose and second dose. What we have seen is that persons develop a better immune response to AstraZeneca when it is stretched out over 3 months. And that's the best immune response that you will get. We started out again with the Sputnik vaccine at 3 weeks to 4 weeks, 21 to 28 days. New data emerging again suggests that you have a better immune response again if you were to stretch out the dosing again up to 3 months. We don't know if there's more to come, if there's better data that will present itself. We don't know if we'll need another booster dose after a year, after 6 months, or whatever. But what we do know is that these vaccines protect us in at least the short and medium term, that we do not end up in ICU, we do not end up on a ventilator, and we do not end up dying. Just recently, we've heard the news that the government of Guyana would have started the process of getting the Johnson & Johnson vaccine. This is a single-dose vaccine that can be given instead of 2 doses of the others. And this may be more suitable for persons who you have doubts that they will come back for the second dose. And if you can't locate them, then it makes it very difficult to just give 1 dose, which is considered incomplete for the other vaccines. But if you have a vaccine like the Johnson & Johnson that you only need 1 dose, then you get that patient, you give them that 1 dose, and as far as we know at this point, we do not yet require a second dose for Johnson & Johnson. This may be best suited for persons in the hinterland region and where travel is much more of a challenge than it is in the coastal or urban areas. And so hopefully we get these soon and we can continue to have this vaccination drive success that we have enjoyed here in Guyana. And this is largely due to our procurement practice as well as the efforts of the persons at the healthcare sector level, at the Ministry of Health as well as the primary care level, to give vaccines to our population. So thank you once again for joining me on this program. Remember, if you have any questions or comments, please feel free to send a WhatsApp to 620-6275 or send an email to docandcovid@gmail.com. Thanks again.